Are you struggling to find the right path in your counseling career? A counselor is a person trained to give guidance on personal or psychological problems. A counselor applies psychological theories, techniques, and interventions to work with clients to improve mental health, wellness, personal growth, relationships, or career development. Counselors focus on helping people make changes which have long-lasting effects. Guidance, on the other hand, is about helping individuals choose what they value most. Counselors work in a wide range of community settings to provide a variety of counseling, rehabilitation, and support services. Depending on their interest, counselors may choose to specialize in a particular area of work, for example, family counseling, mental health support services, career counseling, and so on. They work with children, adolescents, adults, families, organizations, hospitals, etc. Needless to say, the role of a counselor is a challenging one. They are required to work on personal issues of individuals at a professional level, following ethics and principles of counseling. Certain attributes of the individual contribute to becoming a successful counselor. Let us look at some of these. Patience. Working with people needs a lot of patience. Many people who go to a counselor are dealing with mental health issues, family issues, personal issues, and are likely to be under stress. Counseling cannot be a rushed process. A good counselor will allow the client to take their time to open up and discuss the issues they are facing. They must not assume anything and encourage the client to disclose their feelings, emotions, apprehensions, etc. Good, active listening. Listening is the key to a good counseling session. Do not make assumptions. Do not read between the lines. Listening with patience is essential. Do not rush the client. Do not interrupt while the client is talking. Observant. A good counselor needs to be very observant and grasp nonverbal communication, for example, fidgeting with fingers, not making eye contact, clearing the throat very often, etc. Warm. An experienced counselor should be able to show non-possessive warmth, which is comforting to a client. Show concern and acceptance to the client. Knowledgeable. Counselors should possess knowledge not only about the techniques of counseling but should be socially aware, possess some knowledge about medications, alternate medical practices, social practices, etc. Understanding why individuals behave in a certain way will help the counselor in assisting the client. Having empathy with the patient, clients go through a range of emotions during the counseling process. Counselors should be empathetic and non-judgmental during the process, maintaining a therapeutic relationship with a patient. As counselors deal with a lot of personal issues of the clients, it is very easy for a client to mistake it to be a friendly relationship. Counselors should take care to discuss the nature of the therapeutic relationship with the client at the very beginning and set clear boundaries. Confidentiality. Confidentiality is perhaps the essence of counseling and the most important ethic of counseling. Clients discuss emotions, feelings, etc. with a counselor in confidence, and the counselor is bound by the principle of confidentiality not to disclose it to anyone. Personal integrity. Maintaining a high degree of personal integrity, credibility, and mutual trust is very important in this profession. Attending behavior. It is important for the client to know that you are paying full attention to him or her during the counseling process. This should be made evident through verbal and non-verbal cues such as facial expression, eye contact, gestures, and body posture. Interviewing, asking questions. Asking open-ended questions, probing questions will help in eliciting as much information as possible from the client. Encourage the client to continue talking by saying and, etc. Closed-ended questions get only yes or no answers. For example, are you feeling good? Open-ended questions give an opportunity for an elaborate explanation or reply. For example, how are you feeling today? Probing questions ask for more details. For example, how did you react to that? Note: avoid why questions because they may bring out feelings that can be complex and embarrassing. Open-ended questions and probing questions because they encourage the patient or client to explore and express his or her feelings. Reflecting feelings. Good observation skills and active listening help in understanding how a patient or client feels. The counselor can discuss your observation with the client. If a patient or client gives a vague answer, the counselor can point this out to the client by saying, "You seem a little uncertain about this." This serves three purposes. A, the client may think about how he or she feels and why. B, the counselor can find out if the patient or client is confused. C, any possible confusion can be cleared through discussion. Acknowledge and appreciate any good practices he or she may mention. Giving information and negotiating changes. Give appropriate information to the client in simple language that the client understands. Use local or regional language if appropriate. Check whether the client understands by asking him or her to paraphrase the information and instructions given. Repeat the information if required. Be neutral and non-judgmental. Avoid contradictory statements and be consistent. If you are not sure of something, let the client know that you will find out and revert with the right information. Process and flow of career counseling. The process of career counseling involves 5 stages. It involves evaluating interest, understanding the needs of the student, and suggesting a career path based on the evaluation or assessment and needs of the student. 5 stages of career counseling. Stage 1, Initiation A, Building Rapport. The counselor needs to develop a good working relationship with the student so that the student feels comfortable sharing information and trusting the counselor. It always helps to give a brief introduction about yourself before asking the student to introduce himself or herself. Drop hints about some achievements, genuine, as it can increase your credibility. Show genuine interest when the student is talking about himself or herself. B. Data gathering. The second step is to get information about the student. It is necessary to involve parents in this process so that the counselor has a good picture of the student's abilities, aptitude, interests, and personality. The counselor can spend a good 15 minutes gathering this information. C. Awareness. Many parents and students are not fully aware of the process of career counseling. It is a good idea to spare a few minutes to give this information and any other relevant information to the student and parents. D. Alliance. The first 3 steps help and lead to the 4th stage of building a therapeutic alliance with the student and parents. By this stage, the clients have a better understanding of the process, have some confidence in the counselor, and are ready to explore some options. Stage 2, Exploration. In this stage, the student is helped in conducting their own detailed analysis. The next step involves conducting different tests. These tests typically cover facets like social behavior, personality, psychometric, and career interests. The third step is a one-to-one interaction between the student, parents, and the counselor. This is an opportunity to explore different options. Stage 3, Decision-making. By this stage, the clients, that is, the student and parents, have enough information about the student, the courses, and so on. The counselor now needs to bring the student and parents to a common platform. The counselor now needs to ensure that the student or the parent does not rule out career options due to perceived barriers. He or she should encourage the student and parents to keep an open mind about all the possible options. The last and most important step in this stage is the selection of the most appropriate option available among the alternatives. Stage 4, Preparation. This is the pre-implementation stage or planning stage. The counselor helps the students in preparing an action plan. The counselor also makes the student aware of any prerequisite skills for the chosen career or education course. The counselor also helps in identifying the required resources for the implementation. The counselor may also discuss an alternative plan and prepares the student for any uncertainties. Stage 5, Implementation. The 5th stage is about the execution of the career plan. The counselor should follow up to ensure that the student is meeting all the deadlines as required to implement his career plan. Ethics of career counseling. Code of Ethics is a practical guide for professional behavior and practice for counselors who offer direct services in career development. Code of Ethics helps professionals to make thoughtful decisions and give guidance to resolve ethical dilemmas. This, combined with the Indian standards and guidelines for career management, provides protection to the clients when receiving services from career professionals. Ethical principles for professional competency and conduct. It essentially means that every career counselor must take the responsibility to keep up to date with the current education courses, economic and employment situation in the country of residence and globally. Ethical principles for career professional-client relationship. Counselors must conduct themselves with integrity, honesty, and objectivity. They must act in the best interest of the student and promote the welfare of the student by providing relevant and accurate information. They must recognize their professional boundaries and must respect the client's right to take their own decision. They should follow the principles of confidentiality and respect the privacy of their clients. They must advise clients of the limitations of confidentiality. When counselors are working with minors, they must take special care about privacy and involve parents as required. Ethical principles for professional relationships. Counseling is a profession. Counselors must discuss professional boundaries with their clients and ensure that they do not cross professional boundaries at any point. Whenever there is a possible conflict of interest, the counselor must inform and assign another counselor wherever possible. They must respect other professionals in the field and take necessary support from their peers in the best interest of the client.